We're going to begin in Mozambique, which is facing its worst cholera outbreak in more than 20 years. Weeks after Cyclone Freddy unleashed widespread devastation and misery. At least 1 million people have been affected by floods in the epidemic. The UN says damage to water and medical facilities is making the spread of the disease worse. 11 other African countries are also reporting increasing numbers of cases. The UN Children's Agency says the east and the south of the continent are facing an emergency. Famara Miller is joining us now from Mwamba in Mozambique. We can't go to Famara right now, but we can go to Guy Taylor, who's talking to us. He's representing UNICEF. Mr. Taylor, tell us about the situation that you're facing at the moment.
Yes, the situation in Mozambique remains very serious. We have more than 1 million people who've been affected by the combined impacts of Cyclone Freddy, coming on top of a cholera outbreak and widespread flooding. We've seen cases of cholera increase around tenfold since the start of February. Now there's approximately 26,000 cases in 10 of the country's 11 provinces. We have seen some stabilization in case numbers in some areas, thanks to a concerted response by the government with support from UNICEF and UN partners, including a widespread vaccination effort of over 2 million people. But we are seeing new cases crop up in areas where they've not previously been. As you said, the worst outbreak of cholera that this country has seen for a long time, with serious effects on children and families particularly.
Cholera is an ever-present condition, but what is surprising is that there appears to be a drop in the number of vaccines and testing kits and medical facilities that are available. Does UNICEF and organisations like yours have enough to be able to try to deal with this problem?
Well, I think there's always a need for more vaccines, and as we know, the global supply of cholera vaccines is very constrained at the moment. We have been able to procure and distribute, as I said, more than 2 million doses of cholera vaccine in Mozambique, and that's had an important impact on stabilizing case numbers in some areas. But I think more needs to be done. But it's very important to emphasize that prevention of cholera vaccines alone are not enough. What is needed is a concerted and coordinated response, which includes, for example, action on providing clean water and sanitation and hygiene, health treatment, and also raising people's awareness and understanding of how to prevent cholera, how to respond to cholera, how to prevent disease and death from cholera. These all need to be delivered together as a package to achieve the greatest impact.
Very briefly, Mr. Taylor, if you're not able, you and organisations like yours are not able to get a handle on this, how bad could this get?
Well, it's very difficult to predict. We're seeing, as I said, case numbers go up by the day, and as you said, this has been one of the greatest or the largest epidemics in recent decades. But it's also very concerning, particularly in the context where you have many children who are experiencing severe acute malnutrition, around 250,000 at least in Mozambique, and that number will likely go up as the impact of the cyclone on food supplies takes its toll. Children who are malnourished are much greater risk of death, around 10 or 12 times more susceptible to dying from cholera than healthy children. So this is the combined impact which really is taking the toll on the most vulnerable children in this country.
Guy Taylor, I know this is a very busy time for you and your team. We appreciate you taking the trouble to talk to us. Thank you very much indeed. That's Guy Taylor from UNICEF Mozambique.
Thank you.
Well, we can speak now to